Monday morning. Thanks for being with us here. Dr. Danielle Martin joining us this morning. The full title here, well, you're a family physician basically, but you've authored this book. It's called Better Now, 6 Big Ideas to Improve Healthcare for All Canadians. It is good to have you with us this morning.
Thanks for having me.
Before we talk about Canadian healthcare, I want to talk about what's happening in the U.S. right now. Donald Trump, just a couple of days ago, on Friday as a matter of fact, signed this executive order to ease the burden from Obamacare, something that he really campaigned on. What does that mean, and what are the effects for all of this?
I mean, I think the reality is actually that nobody really knows what's about to happen in the American healthcare system. We don't have any clarity about if Obamacare is in fact repealed, what it will be replaced with. But it does appear to be the case that 20 million Americans are about to lose their health insurance completely, and that I think is a pretty sitting on this side of the border, it's a pretty terrifying prospect. And as much as we have tremendous challenges in our healthcare system, which I talk about it in the book, I think we shouldn't take for granted, you know, the amazing thing that we have built in our universal healthcare system.
Now, our system very different from the American system, but it's far from perfect.
For sure, and I talk about that a lot in the book, that we have tremendous challenges that we face, and so the question is, what are we going to do about it? We love to talk about our healthcare system in Canada. You know, what's wrong, what needs to be better, all the problems and challenges that we face. But in fact, for many of the situations that we find ourselves in where we're struggling in the Canadian healthcare system, we know what the solutions are. So what we need to do is start implementing those.
One of the ideas you talk about here is making everyone have an accessible family doctor. A big problem for us here in British Columbia.
For sure it is. And you know, I talk a lot in the book. This book is full of stories of my own patients. I think a lot of people will see themselves and their family members reflected in the stories that I tell, and I talk about the importance of having that family physician who you trust and that relationship over time, and how that can really protect health. And we know that there are a lot of people that are struggling in BC to find a family physician, and yet when doctors work together in teams, when they work together in teams with nurses and nurse practitioners and other healthcare providers, we can dramatically improve access overnight, basically, to primary care, and put in place that trusting relationship that is so protective to health and also saves a lot of money in the healthcare system.
When it comes to wait times, a lot of people are impacted by long wait times for a number of healthcare practices right across the board. How can we improve wait times in Canada?
Well, I think we often fall into this trap of saying, oh, well, there are wait times, so what we need is more. We need more money, we need more surgeons, more OR time, but actually, in fact, a lot can be done by reorganizing the resources that are available in the system. I use the example of the grocery store lineup. You know, you go to the grocery store, you've got your cart full of stuff, and then you start doing that dance trying to figure out which lineup is moving the fastest. That's how our specialty wait times work in Canada now. Every specialist has their own lineup. If you go to the bank, they've got a single lineup, and you get seen by the next available teller. So projects like that basically centralize the queue and have everyone in a single lineup have been shown to dramatically reduce wait times in specialties like orthopedic surgery without having to spend any more money.
What about the cost of pharmaceuticals here in Canada?
It's a huge problem, and in fact we know that 1 in 5 Canadian households now reports that someone in that household is not taking their medicine because of concerns about cost. So one of the big ideas I talk about in the book is the pressing need to bring medications under Medicare.
Now, there's a lot of ideas here. How easy are these ideas to implement into the system?
You know, one of the things that we found is that actually almost all of these ideas have already been implemented somewhere in Canada and are working well today. The problem we have had in the Canadian healthcare system is scaling those ideas up so that everybody has access to them. And I think that's probably the most important message in the book is we don't need to look elsewhere for the solutions. We know what works, and it's working today, right now, somewhere in the country. What we need is to make those solutions more broadly available so that every single person in the country who needs it can access the healthcare they need.
When you look at the Canadian healthcare system and you compare it to other healthcare systems around the world, how does it rank?
Well, it depends on what angle you look at it from. Canadians have tremendous pride about the equity that the fairness that underpins our healthcare system, and the fact that people can access their healthcare based on need, not ability to pay. But at the same time, we know that there are long waits, for example, for elective or non-urgent procedures. We know that some people have a hard time accessing a family physician. Some people can't afford to take their medicine. So there are lots of places where we are lagging behind. And what I'm trying to do with this book is to get that conversation going among normal Canadians, not just people who work in the healthcare system or policy wonks or whatever, but people who are affected by this every single day, because I really believe that if we implement these solutions, we would see dramatic improvements in the healthcare that we receive.
Now, you're giving a conversation, you're having this conversation more in depth tonight at an event in downtown Vancouver. If you're not part of the medical community, you're welcome to come check it out.
Sure.
It's at 500 Granville Street and tickets are still available. It was really nice to see you.
Nice to see you.
Thanks for coming in this morning.